speech on possibility of accessible and affordable healthcare for sustainable regional development, followed by a plenary session on the roles of higher education in regional health and well-being. On this occasion, I would like to invite the President of Mae Fah Luang University, Assistant Professor Dr. Machima Naradisan, to deliver a welcoming address. Please welcome.
Excellencies, students and distinguished guests, a very good afternoon to you all. On the auspicious occasions of the 25th celebrations of Mae Fah Luang University, it gives me a greatest pleasure to welcome you all the distinguished guests in this gathering today. Ladies and gentlemen, as an educational institute located at a crossroad of the Greater Mae Klong sub-regions and the heart of ASEAN, Mae Fah Luang University has set our roles in serving the society with knowledge creations through research and international collaborations, as well as in providing higher educations, aiming to pursue and prepare students to become a global citizens who possess understanding of self-improvement and willingness to participate in sustainable regional and global development. Following aspirations of Her Royal Highness Princess Srinagarindra to restore forests and develop people, the university has been making all efforts to meet the needs of the people in both Thailand and Greater Mae Klong sub-regions throughout the 25 years of the operations. Distinguished participants, recognizing the importance of health system transformations to ensure good health and well-being, along with our commitment to sustainable regional development, Mae Fah Luang University, on the occasions of our 25th anniversary celebrations, organized these international symposiums on advancing the global health agenda, transformations on higher education towards regional well-being, and to discuss the challenge of regional well-being issues and the scenarios of transforming educational institutes to cope with global disruptions. Therefore, I would like to invite all of us to take this valuable opportunity to project on how we can collaborate and co-create a sustainable well-being of these regions using education and health as a tool. With these remarks, I would like to once again welcome you all to Mae Fah Luang University, and we are looking forward to deepen our collaborations for the prosperous futures in the regions. Thank you very much.
Thank you so much for your welcoming address, Assistant Professor Dr. Machima Naradisan. And now we come to the keynote speech on possibility of accessible and affordable healthcare for sustainable regional development by Professor Dr. Krishna Graisin, a renowned Thai pharmaceutical chemist, as known as Gypsy Medicine Maker and President of Krishna Graisin Foundation. In 2009, Dr. Graisin was awarded the prestigious Magsaysay Award for formulating the world's first generic antiretroviral drug to treat HIV generally, and her contribution in the accessible and affordable anti-HIV medications. Moreover, this year she was received the Medical Scientist of the Year for her outstanding work in the research and development of antiretroviral drugs, antimalarial medications, and herbal treatments. Please join me in welcoming Professor Dr. Krisana Graisin, who will share with us through online platform.
Distinguished guests, ladies and gentlemen, friends from all walks of life, and the young people who will lead our present and future, I wish to thank the organizer for giving me an honor to be associated with this event today. I sincerely apologize for not being able to attend this important gathering, as I have to be engaged in very important experiment for local communities in Wapi Patum district, Mahasarakham province. It is with much pleasure that I have the opportunity to share with you my personal view and aspiration for my work on domestic production, which leads to greater access to antiretroviral drugs in Thailand and antiretroviral and anti-malarial drugs in African countries. The past 30 years of my life, if I was married, I might have been a grandmother of 1 or 2 grandchildren, but that's not my life. Since 2002, I spent 12 years in Africa, in 17 African countries, helping them to set local manufacturing facilities for anti-malarial and antiretroviral drugs. Once they were self-sustained, I left and then I moved on to another destination. Now, it is beyond dispute that we are in the midst of global health crisis. Millions of people around the world, majority of them in developing countries, are dying because they lack access to life-saving medicine, especially for diseases like HIV/AIDS, tuberculosis, and malaria. Over 90% of the drugs used in Africa are imported. Cost is a tremendous factor in this crisis. As the economic gap between the industrialized and low-income countries widen, so too is the health gap between the rich and the poor. This health gap in care has been called a crime against humanity and Holocaust of the poor. It is certainly making us realize that we need to put an end to this global apartheid of poverty and health. My goal is to help those African nations to set up manufacturing facilities for generic life-saving drugs. Only this, I believe, that will ensure the affordable supplies to support the lifelong treatment of those impoverished patients. Thailand and Brazil, we both have national AIDS treatment program thanks to local production of generic. I was motivated by a sense of fairness and a view of AIDS as a social as well as public health problem. I think everybody should get access to treatment, and if it's not unfair, it is a basic human right. If it's not fair, I will fight to the end, and it doesn't matter what it costs me. Living and working in Africa tests my stamina and patience. It's not comfortable nor easy. It's just like walking in a dark wood on a moonless night. It's a scary and at times frightening experience. I think it was the passion that drove me and the belief in what I was doing. It was a passion that sustained me through the tough time that seemed to justify my life. All of my years living in different parts of Africa, there's one word undoubtedly running through the veins of Africa, that is Ubuntu. Ubuntu means I am because we are, or humanity towards others. One might have thought that that was special to and unique to African region. It's not. Beginning of last year, I worked with Hill tribe people in Tak district in the north of Thailand. People would do the same. Only they use their hands instead of their feet. This is to show the commonality of them and the African Ubuntu. Across many cultures, the concept of togetherness, the concept of harmony, is the heart and center of human history for generations. Harmony is an interesting concept. When you look for harmony, you may not find one. When you want to create harmony, people may question you. But if you are harmony, it's everywhere. I might travel alone, but I never work alone. Everybody is my colleague. Whoever I meet are my team. So this is Africa, and there are 54 countries, and I work in 17 countries, starting from Eritrea, Ethiopia, Kenya, Uganda, Tanzania, Burundi, Democratic Republic of Congo, Gabon, Nigeria, Benin, Burkina Faso, Mali, Senegal, Gambia, uh, Liberia. That's 17 African countries. In many African countries, where many people died of in wartime, my colleagues were technicians, taxi drivers, or housewives. They are now capable of making artesunate or anti-malarial suppositories successfully. I don't just believe, but I know that wherever people trust and honor each other's potential, there is a harmony. I have an abiding faith in sustainable global development and in its pursuit. I follow the footsteps of His Majesty King Bhumibol the Great's signature approach. That is sufficiency economy policy or philosophy to understand the local people design, to be accepted by them, and to help them to develop their full potential. So this is African country. This is very difficult. The most difficult country that I work is Liberia. It's under the US for so many years. Uh, so this is before election. I was invited by Gates Foundation to start up a facility for HIV/AIDS at Liberia Institute for Biomedical Research, but it was impossible because it's a war-torn country. There's no electricity, no water. So I had to utilize this small building inside the hospital to teach people, local people, to prepare suppositories for anti-malarial suppositories. So those people are, only one is pharmacist, the rest housewife, taxi driver, and technician. So those people now can now making artisanal suppository successfully. So this I once they were self-sustained, I left and I could not teach them to manufacture tablets because it's impossible because there's no facility infrastructure at all. So this is another country. Burundi is the poorest country in the world. That is the Lake Tanganyika is the second deepest lake in the world. Again, doing the same. So this is the capital of Burundi, Bujumbura. And I taught them to make anti-malarial suppositories as well as tablets. So this is anti-malarial suppository. And now we are trying to make tablets from, this is artesunate tablets for anti-malarial drug. And this is amodiaquine. You know, you have to use both artesunate is a short-acting malarial drug. And this amodiaquine is a long-acting anti-malarial drug. Just a minute, something wrong. I think you. Sorry for this interruption. Now, so this is amodiaquine. I'm I'm sorry for this interruption. This is very difficult. Can you see the slide in your?
For now, it's just a blank space.
But it's very difficult. Our computer. No?
Should we share from our side? Because we.
Yes, please. Can you?
Okay. So give me a second. We gonna
Yes.
show the slide from our part, and if you would like us.
And I tell you next like that. Huh? This
Okay.
is not very convenient, but it's okay. This is all I can do from here.
So can you see the slide that we're showing here?
So, but this is backward. So I want to move forward. Okay. Can you see now?
Yeah.
So this is and this is a tablet, artisanal tablet, and this is a model queen tablet. Again, this is stop from there. So please show the slide from your side. I think it's better.
So now we move to the next one. Can
So
you
that
see the
is
move?
next one is it on the slide that I see.
Okay.
เปิดอันนี้ให้กว้างเลยครับ so I don't use from my end anymore so I use
Right.
from your end is better
Right.
okay
Okay.
so just to enlarge this just give me a second okay anyway กลับไปตรงกลาง okay so it's very small but I cannot help it it's just like that. So this is a quality control of anti-malarial drugs. So I taught them the quality control process as well. The next one, please. Can you move to the next one? Just close. So this is from your end, is it? It's from your end or from my end?
So now we controlling slide for you.
Okay.
So the
that's
picture
fine.
of a
So
lion, right?
Uh-huh.
With the green background.
So this is another country. It's a Democratic Republic of Congo. I spent there 3 years setting up the factory, starting from building the factory until the end. That means that they can manufacture antiretroviral drugs. Next, please. Please, can you move? Okay, so this is the factory. Now you can move quickly. So this is to drawing the layout of the plant that I did it myself, and then 3-dimensional. It's just like this. So it took me 3 years to build this factory. It is very small factory, but it took a long time because of the war, the fighting. They were fighting all the time, and so many people died of this war. So, please. So this is it. So this is the area is only 300 square meters, but it is difficult, very difficult. You can move quickly now. So this is the first antiretroviral drug in Africa that I manufactured, named Africa, and Via. Of course, it's antiretroviral. Yes. So I presented this in this is a German parliament and minister for development. So she also donated huge sum of money to purchase the equipment, materials and equipments to start up the antiretroviral drug production. So this is how I work in the laboratory in the DRC, Democratic Republic of Congo. So this is the first tablet that I manufactured there. So now you can go quickly because it's just a picture of that. So, so these are the products. And now there's another country is Tanzania. Tanzania, I helped them. I think I visited Tanzania. I went to Tanzania 42 times in 5 years, and I could, of course, manufacture anti-malarial, antiretroviral, and building the new factory or renovating the factories. Yes. This is Tanzania, of course, anti-malarial and antiretroviral at the same time. So it's Kilimanjaro. It's the highest mountain in Africa. This is Mount Meru. This is Arusha. I worked at Tanzania Pharmaceutical Industries. This is the factory that was 42 years old and could renovate this plant and start manufacturing ARV drugs. So my team are technicians, only one pharmacist, the rest are technicians, electrical technicians, mechanical technicians. So these are the products, CT Thailand, Tanzania, and beer. So this is the inauguration of my first antiretroviral drugs in Tanzania. This anti-malarial drugs, and that was a French television. They filmed this activity. So Thai Tanzanite, that's I name it myself, Thailand, Tanzania, and artesunate. And so the cost of treatment for 6 tablets, if you were to import from Europe, it was 8 euros, but my product cost only 40 cents. So that 12 million people can benefit from these products. So we have a dry powder for children, for suspension for children, and also tablets for adults. So whatever I have for adults, I must have for children. Then I moved to West African countries. Mali, first country is Mali. It was in Sahara Desert. So it was very, very, very hot. Normal temperature there when I worked was 52 degrees Celsius. Yes. So this is the factory was built by the Chinese. Mali was under French, but then after the independence, they went with China. So many people graduated from China. All the employees at the factory graduated from China. So all the machines or production machines are from China. So it's very old, very, very old. But I could manage that so that it can work, and then we can produce anti-malarial tablets. Yes. So this is a blister packing machine. So artesunate, and we have amodiaquine as well. Please. So this is amodiaquine. So this is another country, Mali. So you can move on quickly because there are so many countries. This is Mali, and they fix those combination of artesunate and amodiaquine. And this is Benin. So those are orphans whose mothers die or parents die of AIDS. So this is a German foundation. They supported this organization. So I went there to teach them to prepare suppositories for children, especially under 5 years old. So this is how I taught them. It's the same. It's very simple and it's easy. So this child came to the health center with cerebral malaria. He about 40 degrees Celsius. He was going to die, but I use artesunate suppositories. I just finished it, and the child survived. And that was, I think, this changed my life. That in this life, if I can help one person, and I think it's worth living. So Burkina Faso is another landlocked country in sub-Saharan Africa. It's the same, doing the same thing. It's just different countries. So in Gambia is English-speaking country. And also, I taught them actually in the hospital, Royal Victoria Teaching Hospital, to prepare artesunate suppositories. This is this. So they are technicians. These are real technicians, not a driver or taxi driver or housewife. So it's a Senegal. This is Senegal. It's a West Africa. Yes. So I taught the medical doctor, a man, and 2 ladies, one biochemist, another one is pharmacist. They could do it very well. They are very smart. So it's Zambia. Zambia is another English-speaking country. So it's easy for me. Wherever they speak French, of course I don't. But how I taught is that I did it first, and then they just look at me and they just do it. And they just write what they do, and they just do it what they write, and that's it. So it's not that difficult. So language is not a problem. This is the now pharmacy of Zambia University. So this is Kenya. Uh-huh. I help westernmost Kenya in Karungu district, where grandmother of President Obama lived. So I didn't know that time that she lived there, but anyway, we met and we communicated and we talked. So this is Kenyan people to do the same at Chameleon Hospital, that is a Catholic hospital. Mhm. So this is Africa for 12 years. I worked there. And that's it. So I came back home and then I started working on, well, I was a dean of faculty of pharmacy one time at Transit University, setting up manufacturing facility for faculty of pharmacy so that the students can have a place to practice. Otherwise there's no place to practice. I mean, if you went to manufacturing facility, they would not allow you to do it because you are new. You don't have experience, so it's better to set up at the faculties at the university. So this is my own foundation, started 7 years ago. So my first project was actually I started this project before I went to Africa. I went Langkasuka model that is in 3 southern provinces of Thailand, Yala, Pattani, Narathiwat. Of course, it was very, very, very difficult, but it is possible. I spent there 13 years and 11 months, almost 14 years. Yes. So this is Langkasuka model. Langkasuka means this kingdom of 3 provinces. Mm-hmm. So these are local people. Of course, they speak Yawi language. I could not communicate with them, but I use interpreter for the communication with them. But that's not a problem at all, because I work in Africa. I could not speak French. I could not speak German, but it's possible. So these are local people. As you can see, a lot of women there because men, they work at night, so during the day they rest and they sleep. So we see only women, because one may be surprised that where are men? So they are there, of course, but at home. Okay. So I wanted to set up a factory. Wherever I go, I mean, if you want to start manufacturing herbal medicine in other places, you have to start from growing medicinal plants, and then to manufacture and then to use in the hospital. But in southern Thailand, in 3 provinces, you cannot do that because it is very dangerous, the place, and you cannot talk to them or persuade them to plant any medicine plant. So I started with building the factory first, so that they can manufacture and they can use, and then go back to the beginning, the starting, that is growing of medicinal plants. So this is how I started manufacturing herbal medicine in Janet Hospital in 3 southern provinces. Okay, so this is a process. Borrowing facilities from other people. So this is the dentist house that I used to start manufacturing curcumin or turmeric capsule. That's it. So I started in 3 provinces, in Yala at Yaha Hospital, in Pattani, in Saiburi, and in Kapoor, in Narathiwat, in Janet this hospital. So I brought them to Rangsit University to be trained on manufacturing of turmeric or curcuma longa capsule. So this is the packaging, and of course we have to ask for halal certification. Next one. Mm-hmm. So we invited the Muslim communities to come there and inspect of our facility and grant halal. Mm-hmm. And then so this is the inauguration of 4 factories at the same time during the December 2004, I think. So it was 7 years ago, 8 years ago that we inaugurated. So all those factories or in those countries, those provinces, they started manufacturing. That's okay. Mm-hmm. So this is Saiburi Hospital. Mm-hmm. And so from Janet Hospital, as you can see, if you remember the first slide in Janet, you see it's just a house, the dentist house. Now we got the grant for 20 million bahts, building new factories that GMP certified. That's it. So it took 4 years. And this is the quality control of the product. I asked Narathiwat University, Narathiwat Rachanakarin University, especially Faculty of Science, for the quality control of this. And then I went there to train those people myself. There's no problem at all. They could do it by themselves. So this is training on production as well. So now this herbal mobile processing unit, this is an innovation. Why I wanted to have this processing unit, this herbal processing unit that is mobile. You know, in communities in three southern provinces, they live far apart, and in each community, maybe there are only 30 families. And when they grow medicinal plant, and they have to carry those to the factory, which is impossible because it's far away, and then it costs a lot for the transportation. So I think it's better to have a factory going to the community. That's why I invented this mobile herbal processing unit. So this is it. And then, of course, I have to make sure that local people can use this factory. This factory is not for myself. It's for local people. So this is, after I finished in, that is about 5-6 years ago, I finished this mobile processing unit. And the first first plant that I used was turmeric or curcuma longa, which means after you harvest, you wash with the machine on this mobile truck, and then you boil, and then you slice into pieces, and then put in the oven, and then after that finish with the microwave. This microwave is another invention that it will take only 30 minutes instead of 1 week to dry turmeric. So this is it. So this is the first mobile processing unit. The truck was donated by Thai Beverage Company, but the machines on the truck by my own foundation, Krisana Kaisin Foundation. So this is it. Turmeric, when you powder it, it's just like that. So everything can be done on the truck, which is very good. And in one day you can process 200 kilograms of the plant. So this is it. It's the powder curcuma longa or turmeric. Of course, I have to teach everything. This is how to clean, because it's the production of herbal raw material. So it has to be very clean, the place. So the second mobile unit is for quality control. This was donated by Electricity Generating Authority of Thailand, or EGAT. They gave me a grant for 2.2 million baht. Of course, I renovated from very old bus, 30 years old, in collaboration with Faculty of Pharmacy, Prince of Songkhla University, and Tipco Biotech Company. It took almost 2 years to finish this. So when finished this is a quality control unit that is mobile, which means when you take the first truck to the plantation, you can move this second one as well to the plantation, so that we can analyze at the same time. So we know how much active ingredient in the plant is. So this is inside the quality control unit. That's it. So this is she was Dean of Faculty of Pharmacy, Prince of Songkhla University. Now it's the third truck. Third truck is for an Enterographis paniculata or Fatalizone. I did it before COVID pandemic, of course. So this is a truck that you need a truck to pull this unit. Inside there, of course, I design and then have it made in Nakhon Ratchasima province, and so there must be a what is it? A truck to move it, otherwise it cannot move by itself. Okay, so this is it. So this is these people from southern provinces, from Pattani province. They grow this Enterographis paniculata, and you know that in 3 southern provinces, it has highest content of endographoli, that is active ingredient, 7.6%.
Ajahn Ka, excuse me,
Yes.
we are having fun and still enjoying listening to your experience sharing. However, with our time limit, I would like to ask you to maybe
So
close up, yeah, your speech.
how much time that I have?
Maybe like couple more minutes.
Okay. So you can just move the pictures, and of course I have given hand out to all of you. So now you can you can read by yourself, of course. So this is Andrographis paniculata that can process 1 ton per day, 1 ton, 1,000 kilograms. So this is it. Mhm. And next our foundation has donated all three processing units and quality control unit to Janai Hospital in June last year. Mhm. That's it. So this is and so this is Endographis paniculata. Mhm. In Champasi model. Now we are in Champasi model, which is Surin, Mahasarakham, Roy, I don't know,ศรีสะเกษ. So this is in this area, and I'm working here in Champasi model, and we will be moving tomorrow to Samun model. So this is in Surin province. Mhm. So we start with checking quality of soil and water, and then we start planting, of course, all organic. All the plants, medicinal plants that I use are Curcuma longa, Andrographis paniculata, and Solanum family. This is Solanum family. Mhm. So for cough, yes, okay, quickly. So you can just move very quickly until the end of the slides. I just want to conclude my talk with it is my great hope that the humanity still has a heart filled with compassion that goes beyond the color of one's own skin and one's own border. I hope that people will begin to realize that our brothers and sisters are dying in tragic number. And I hope that people are truly more important than profit in this business that is life. So I just want to end my session with a quote from Benjamin Franklin. Tell me and I forget. Teach me and I remember. Involve me then I learn. Thank you very much.
Thank you very much. And I would like to conclude just in a couple sentences here from your long pharmaceutical journey for well-being of everyone. Dr. Grayson was driven by her passion with the aim to close the gap between the rich and the poor that results in togetherness and harmony of mankind. And she also stated that when we try to look for harmony with our physical eyes, we might not find it, but actually it's everywhere around us. Dr. Grayson, I would like to ask you to remain online with us because next will be our photo session in order to keep this memorable moment together. And yes, you can. Okay, so let me invite the first moderator to be on stage. Dr. Nishan Singha Puttangun, the Director of ASEAN Research Center for International Development. He will be our moderator today for the plenary session, but we're going to have the photo session with Ajahn Dr. Grayson and all together with our plenary speakers. And while we're waiting for the setup of the stage, I would like to share with you that Mae Fan Luang University has a goal to become the University for Well-being and Sustainable Future. MFU has inaugurated the School of Medicine, the School of Dentistry, and MFU Medical Center to be regional wellness and healthcare center for educational and research for medical and health science excellences in Greater Mekong sub-region. Okay, so we have the stage ready now. So let me invite Dr. Nishan Singha Puttangun, the lecturer of School of Social Innovation and also the director of Asian Research Center for International Development. He will be the moderator of plenary session today. And next, let me invite His Excellency Kampan Anlawan, Ambassador Extraordinary and Plenipotentiary of Embassy of Laos People's Democratic Republic to the Kingdom of Thailand. Next, let me invite Lieutenant Sorawut Pridi Dilo, Minister attached to Thailand International Cooperation Agency or TICA. Next, Assistant Professor Dr. Machima Naradison, the President of Mae Fah Luang University. Next, Dr. Vipat Kurujit Tham, Executive Director of Southeast Asia One Health University Network or CEO HUN. Next, Professor Richard T. Mazias, Medical Doctor, Professor of Medicine, School of Medicine, Oregon Health and Science University, United States of America. And the last one, our Assistant Professor Dr. Tirani Techa Sivishian, National Professional Officer, Public Health, WHO, Thailand. Okay, and we will take a couple moments to take a picture also with Dr. Graisin online. Thank you so much, Dr. Graisin, to remain with us. And thank you so much for your meaningful, touching speech and also experience sharing with us. We learned a lot from you. Should I count? 1, 2, smile. One more time,นะคะ. 1, 2, smile. Okay, thank you so much, อาจารย์กฤษณาค่ะ Thank you so much for your meaningful speech today, and thank you so much that you give us. We are so honored to have you with us today. Bye bye ค่ะ
Thank you.
Now we come to the plenary session on the roles of higher education in regional health and well-being, which will be moderated by Dr. Nishan Singhaputhanggun, lecturer at the School of Social Innovation, Mae Fah Luang University, the Director of Asian Research Center for International Development. And I will pass the stage to Dr. Nishan, and while we're listening to the plenary session, all questions welcome. You can just pass to our staff or pass a paper to me. Thank you.
Thank you very much, and I would like to take this opportunity to say welcome to our participants again to the plenary sessions on the title, The Role of Higher Education on Regional Health and Well-Being. And as our keynote speakers, Professor Krishna Graisin, I think she has paved to this sessions on several issues based on partnership, based on several interesting concepts and words of harmony and in terms of partnership. And she has linked from the international levels to regional levels and local levels, and coming back to Thailand, to different part of the region, mainly in the south and going to a part of the northern part of Thailand as well. So today, before we start the plenary sessions, may I give a brief background of each of the panelists first, starting from His Excellency Kampan Anlawan, Ambassador Extraordinary and Plenipotentiary, the Embassy of the Local People Democratic Republic in the Kingdom of Thailand. His Excellency has his MA degree from Moscow Institute of International Relations in Russia and from Canberra College of Advanced Education, Australia. He firstly joined the Ministry of Foreign Affairs in 1986 and continued to serve in different positions in the ministry, such as Director of Divisions of Asia Pacific and Africa Department, ambassadors to Malaysia and to Papua New Guinea, and also to the United States of America and Canada, and recently to Thailand, and especially as the permanent representative to UNESCAP. Thank you. Second, our second speaker, His Excellency Lieutenant Sorawut Prididilok, Minister attached to Thailand International Cooperation Agencies or TIGA, and Minister at the Thai Embassy at Helsinki. His Excellency has his BA and MA degree in Political Science from Southern Illinois, the United States of America. He firstly joined the Ministry of Foreign Affairs in 1994 and continues to serve different positions in the ministry, such as the First Secretary at the Embassy at Pretoria, Minister Counselor and Minister at the Thai Embassy in Berlin, Minister Counselor at the Thai Embassy at the Berlin and Federal Republic of Germany. Currently, His Excellency is the Minister attached to Thailand International Cooperation or TIGA and Minister at the Thai Embassy Helsinki. Please give a big applause to His Excellency. And our third speaker is our President, Assistant Professor Dr. Machima Naradison. She received her BA degree in Agriculture from Chiang Mai University, MA degree in Agriculture, Plant Pathologies, the University of Sydney, her PhD in Post-Harvest Technologies from the University of Adelaide, Australia. She has joined Mae Fah Luang University since 1999 as a lecturer at the School of Agro-Industry and served as various both academic and administrative positions, such as the acting dean of the School of Agro-Industry, assistant to the president, vice president, and currently as the president of Mae Fah Luang University. Our fourth speakers coming from the United States of America, Professor Richard T. Marshall, medical doctors, Professor of Medicine, School of Medicine, Oregon Health and Science University, United States. Professor has his BS from University of Pennsylvania, Philadelphia in biology. Professor has his MD, MA in medicine from the Harvard Medical School in Boston. He also joined the American College Physicians, Executive Physicians in Management Phase 1 until Phase 3. And he also also part of the Foundation of Medical Excellence, Healthcare Leadership for the 21st Centuries. Very significant appointment in the medical field, such as research fellow at the Harvard Medical School, instructor in medicine at the Harvard Medical School, director bone marrow transplantations program at Oregon Health and Science University. He has a lot of award and publication that I could not conclude it here. So let me give the applause to Professor Richard, please. Our fifth speaker, our panelist, Dr. Vipat Kurujitham, Executive Director, Southeast Asia One Health University Network, or CEO HUN. He has his BA in Engineering from Chulalongkorn University, MA Engineering from Cornell University, United States of America, MS Major Decision Science and Operation Research from University of Wisconsin, USA, and PhD in Major in Health System Engineering from University of Wisconsin, USA. He served in many positions with international organizations, such as Deputy Director, Specialist, Analyst for Southeast Asian Minister of Education Organization, or CMEO, the Regional Center for Higher Education and Development, RIHEDS, United Nations Development Program, UNDP, as well as a lecturer at the College Public Health Science, Chulalongkorn University. And currently, at the present day, he is the Executive Director of Southeast Asia's One Health University Network, CEO HUN, and as well as the member of editorial board, Pan-Africa Medical Journal, One Health. Please give a big applause, please. Last but not least, our last panelist, Assistant Professor Dr. Tirani Techa Sivichian, National Professional Officer, Public Health, World Health Organization attached to Thailand. Assistant Professor Dr. Tirani has her BA degree in Biological Science, Biomedical Science, concentration from Mahidol University, MA degree in Agriculture from Graduate School of Agriculture, Kyoto University, Japan, a Doctor of Medicines from Graduate School of Agriculture from Kyoto University, Japan. Very significant academic and research positions in the public health and global health area with the Department of Global Health and Socio-Epidemiology, School of Public Health, School of Medicine, Kyoto University, as teaching assistant, research and assistant professor with numerous research grant, journal, and publication in this area. She is currently working in the World Health Organization, Bangkok, Thailand, and taking care of several criteria injury and disability, in particular road safety, environmental health, air pollution, climate change, many areas under the health system, and also support country cooperation strategy, what's so-called CCS, from 2017 to 2021 and 2022 until 2026, and implementations of the Secretariat to the MNE Committee and Executive Committee. Please give a big applause. It's not very easy to moderate a high profile of all a speaker like this, so I try to make it very brief. Let me go to the objective of this panel. There is 3 objectives of this panel. The first one is to discuss challenges of regional health and well-being issues under multiple disruptions that take place at the national level, regional level, and global level, resulting in various insecurity, bringing uncertainty and unsustainabilities in advancing and promoting health and well-being in GMS and Southeast Asia. Second, we want to learn from the educational institutions inside and outside the region of Southeast Asia or GMS, and also to learn from the network inside and outside in terms of well-being and to promote their well-being and sustainable development in terms of health with their best practice and experience in GMS and Southeast Asia. And the very last objective, which is, I think, is the most important, that how can we transform what needs to be done to actions, which is about proposing some approach, model, or policy in promoting good health and well-being for people by emphasizing on partnership, emphasizing on the word partnership, with different actors in various levels to work with higher education institutions in GMS and Southeast Asia with their perspective, experience, and best practice in GMS and Southeast Asia. So that's the objective. And how are we going to conduct this panel? Firstly, there are 3 rounds of discussions with 3 questions. Each speaker might take up to 5 minutes or to 10 minutes per round. And the questions, there are 3 questions. First round will be the questions on the challenges and your role for regional health and well-being. Second would be about the role of higher education in the sustainable era. And the last one would be the higher education partnership. And at the end of the last round, the last questions, we will give the floor for about 10 minutes to share and discuss and comment. So without further ado, may I bring you to the first round of the questions. So the first round is about challenges and your role for regional health and well-being. As you know, our world and our regions face several challenges related to global health, regional health and well-being. These challenges span a wide range of factors, including social, economic, environmental, and healthcare-related issues with negative impact to people. In your opinion, what are these challenges that our world or GMS or Southeast Asia is facing now? And what is your role in terms of to handling these challenges? So in this case, if we might start with Your Excellency to share some thoughts about this question, please.
Thank you very much, moderator. Good afternoon, everyone. Madam President, thank you very much for inviting to join this symposium. When we talk about the well-being to the people, I think expressed quite easily, but put into action, not easy. For the challenging, I just would share with you that, of course, first, unexpected, unprecedented outbreak, like a pandemic, COVID-19. I think that more than 3 years, everything collapsed with outbreak, especially even in Laos. Of course, we have some loss, casualty. Just as I said with Dr. Richard, even in the United States, I think more than 6 million die of COVID. Is it unprecedented? And second one, recently our region faced the haze, transboundary haze pollution. That's why I think the last April, Prime Minister of Thailand, General Prayut, invite our leaders from Myanmar and Laos to have quite urgent online summit to how we can control this haze. I think another challenge is where we didn't expect it also. For the haze, of course, we in the ASEAN framework, I think the Chiang Rai MOU also on ASEAN, we put, I think, more than 5 years ago. But we cannot control, we cannot tackle this problem. Of course, from the analysis, they put the hotspot more or less Laos the number 1, Myanmar number 2, Thai number 3 something. But of course, this, I think, especially in the north of Laos, people still enjoying slash and burn cultivation. Because in the north, more or less in the mountainous area, mountain plain. Another challenging that we have to cope. And of course, not mention another challenging for the international situation, like a geopolitical armed conflict, even the big power just fighting. And of course, they put a lot of money for this arm race, but less to our well-being to the people. Such thing, I think, we have to think of. Even the policy makers, diplomats like us, we have to think of how we tackle this. For the COVID-19, I think we're not sure that where the original, still discussing. China, United States. That's why how can we prevent in the next decade? We, as well, of course, we innovated every new idea, even academic, to prevent on such challenges. What for the like COVID? How can we prevent it? Just with only rescue. No preventive measure. And that's why I think that our academic, how to think of. Of course, we have used to malaria or another tuberculosis, okay, common disease our region. But for the COVID, I think the worldwide affected. Such challenging where we have to think of. Just like a Mefa Luang, they put a lot of innovation, good idea in preventing things. Maybe in a couple of 5 or 10 years, to think of this, like the sample. We can have a research even come to Laos, like a Dr. Krishna. If we have more than one Dr. Krishna, like a challenging, ranger, even very dangerous area in South Africa, prevent on, make medicine, preventive measure for our good health and things. I think it's a good example. I appreciate that she got the Magsaysay awardee. Yeah, such thing I think we have to think of. Not only rescue them, how to prevent it is our challenging. Thank you.
Thank you so much, Your Excellency. So to move forward to Your Excellency, Lieutenant Sorrowwood, please.
Thank you very much. First, on behalf of Thailand International Cooperation Agencies, I would like to offer our congratulations on the 25th anniversary of the universities. TICA has enjoyed relation with the Mephalong universities since 2015, and we are proud to call you a partner. And thank you for your friendship and best wishes for continued success. First, I would like to brief a little bit about TICA. TICA is Thai Government International Aid and Development Agencies under Ministry of Foreign Affairs of Thailand through its development cooperation policies and global partnership. TICA development cooperation is in line with the United Nations 2023 Agenda for Sustainable Development and the Sustainable Development Goals of United Nations, and focuses on sharing Thailand's success with our friends in various sustainable development sector ranging from agriculture, food securities, education, public health, tourism, and community development. Uh, our two core missions are connecting the world to Thailand. Our partnership with the development countries and international organizations bring in expert transfer of technologies and innovative solutions which are beneficial to our national development. And the second mission is connecting Thailand to the world. In order to provide the technical assistance to other developing countries, we also join hands with developed countries. TICA has provided technical assistance and cooperations in collaboration with the development partner in various forms, including development projects, dispatch of Thai experts and volunteers across the world, donations of equipment, essential items, and human capacity building through TICA scholarship and training programs. TICA is open to new ideas and initiatives that will further strengthen our role as a training and resource hub for development. We share benefit from Thailand best practices and experiences, especially the application of the Sufficiencies Economy Philosophy, or SEP, of His Majesty the late King Rama IX. Every year we offers approximately about 1,000 scholarships and awards under Thailand International Postgraduate Program, or we call it TIPP, and annual international training courses, AITC, which are open to applicants from both the government and private sector, nominated by Thai government. Both AITC and TIPP focus on topic of our expertise, which can categorize under 6 themes: sufficiencies, economy, philosophy, public health, climate change, and environment issues. Technical assistance through scholarship and training is one of the tools to deepen our friendships with countries in our immediate regions and beyond, such as African, South Pacific, and Latin America. By doing so, TICA helps to open windows of opportunities for further cooperation in the area. Now I would like to touch on the question. Sorry. Global health challenges cannot be resolved by any single countries. Therefore, public health cooperation is prioritized area in TICA development policy aimed at enhancing access to effective and timely medical treatment and medicines. TICA works closely with the Ministry of Public Health to help strengthen health system in many countries, especially with our neighboring countries in Mekong sub-region, including Cambodia, Laos, PDR, Myanmar, to achieve Sustainable Development Goal 3, good health and well-being. Being proactive development diplomacies to address global health threats, trilateral, sub-regional, and regional framework, we seek to ensure equitable access to health services for everyone, which will gradually reduce development gaps in public health care system and improve the quality of life for all. Countries in GMS have been facing a wide array of health issues which jeopardize the region's securities and economic development. Regional public health challenges and borderless and represent critical issues that demand our attention and strategic planning. As the world becomes increasingly interconnected, regional and health insecurities has the potential to impact not only local communities. Regional health insecurity has also created instabilities in entire regions. In this context, mitigation health insecurity is vital to ensure healthier and more resilient futures. The regional challenges and TICA role in terms of public health are as follows. Inclusion issues. The 2030 Agenda of Sustainable Development concept of leave no one behind has become an imperative guiding principle for equitable development. It's underscored the importance of equal access to opportunities and benefits. TICA inclusive knowledge and innovation sharing to ensure that no one will be left behind, emphasizing its potential bridge gap, empower marginalized communities, and drive collective advancement in our national regional securities. Tiger Road's development projects and training program are designed to promote inclusive activities and improve the well-being for all, including marginalized individuals through inclusive knowledge and innovation sharing for the form of technical assistance. This including one Tiger delivery of innovative side turning bed. This is in Muang Pon Hong Hospitals in Lao PDR. And secondly, the third country training program, we call it TCTP, on strengthening disability inclusive disaster risk reductions in the ASEAN region. Next slide, please. Sorry. Next slide, please. Oh, so sorry. Oh, that's okay. Sorry. No. Okay. The third country training program, strengthening disability inclusive disaster reductions in ASEAN regions. So there's bilateral training course we jointly organized by TICA and Japan International Cooperation Agencies, or JICA, in collaboration with Asian Pacific Development Centers on Disabilities, aim to empower persons with disabilities through training of the trainer and strengthening disability inclusive disaster risk reduction in ASEAN member countries. And third, the online annual international training course, AITC, on strengthening community health system to support aging societies. And there's a cross-border health concern. So cross-border health issues known as no boundary, and making disease and health threat easier to transcend and within the regions. The importance of international cooperation in addressing these challenges is essential to share resource, knowledge, and expertise, enabling a more effective response to health crisis. By working together, countries can strengthen their collective capacity to respond to cross-border health issues, ultimately safeguarding regional public health. So I would like to just add a little example. Our role and project is, one is border public health between Thailand, Cambodia, and Laos, PDR, Myanmar. It's a three-year programs. Is TICA and Ministry of Public Health have implemented a development cooperation program on the public health to respond to outbreaks of emerging disease along with the borders between Thailand and its neighboring countries. There's an example. What we did is the construction of extension of emergency service department of Poipet Referral Hospital and handover of ambulance at Muang Konburi Hospital in Bantay Minjay province in Cambodia. Second is construction of emergencies department of Kokong province in Cambodia. Third is development of Phonhong Hospital in Vientiane province in Laos PDR. And development projects in Bo Kao province hospital in Laos PDR. And fifth is development of Pak Song Hospital, Champasak province in Laos PDR. And then the most important, we have a master public health program in border health management organized with Mae Fah Luang universities. So this program is a scholarship under ACMEC frameworks designed to equip a student with necessary skill in public health with a particular focus on sustainable inclusive development for community health, border and health management, and prevention and control of emerging and re-emerging disease. Students from ACMEC member countries are expected to conduct research that foster innovation in public health within the context of sustainable development for the region communities. Health. Moreover, all students receive hand-on training in community engagement through field study and practicing trainings. And I would like to give a last example. What we did is on the COVID-19 recovery and preparedness for emerging disease. Actually, we do have a long-term, mid-term, and short-term plan. But I just would like to give just a quick example because of time constraint. The online training course, TICA has completed several online annual international training course or AITC on COVID-19 related topics with the participation of more than 200 health personnel from the regions and 30 other countries worldwide. Example of the course in 2020 are one, collaborative and development of health system, how to strengthen the capacity of public health personnel during COVID pandemic. This by Chiang Mai universities. And two, early childhood health and healthcare management beyond COVID-19 era. This we call with Prince Songkha universities. And for the AITC on COVID related for the coming years, one is networking and capacity building of biomedical personnel in developing countries for facing emerging and re-emerging infectious disease. We call with Chiang Mai universities. And second is early childhood quality in new normal era opportunities of community capacities. We call with Panjapiwat Institute of Management. And third is a global one health approach for communicable disease curriculum. This we call with the Department of Disease Controls. Okay, thank you very much. This is what we did related with the health topic.
Thank you so much, Your Excellency. Now let's move forward to Maphalung University, to the President. Oh, sorry, my mistake, because she told me already that she wants to learn from everyone because as a host. So may I move to Dr. Virat? I'm very sorry.
All right, Excellencies, Madam President, distinguished guests, ladies and gentlemen. So thank you very much for inviting Southeast Asia One Health University Network to participate in this panel, and congratulations to the 25th years anniversary of the Maphalung Universities. So let's pick up on the two excellencies that mentioned about the COVID-19. This is actually the core mission of what we do at Sihun. So actually, we have witnessed the steady increase of the frequency and diversity of disease outbreak over the past 3 decades. So it's not new that the COVID-19 pandemic, actually, as we see that it was the most devastating one. And if we try to imagine that today, that I just looked it up yesterday, it's about 7 million deaths to date caused by the COVID-19. So to digest that message easily, the visual Director General Tedros actually put it simply as one death every 3 minutes. So if you're sitting in this room for about an hour, so that's cost about 20 lives already. So that's how bad it is of the COVID-19. So we don't want that to happen again, right? To tackle such a complex challenges of the COVID-19, is actually require people from multiple disciplines and multiple sectors to work together. No one knows it all. It's such a complex challenges. So we need someone who be able to communicate, collaborate, coordinate, and basically work together, and what we call as a One Health approach. So this is what we try to promote. So as we know, the infectious disease has no boundary. So when it comes in, you cannot say that, okay, please stop. Do you have a visa to get in, right? So it just come in. So experts also say that it's not a matter of if, but it's a matter of when the next outbreak will happen. So let's imagine how fast diseases can spread. So if infected persons hop on the plane from Bangkok, travel, let's say only about 6 hours from Bangkok on the flight, the disease can easily spread to half of the world populations within 6 hours. Try digest that. When I heard that for the first time, is it really true? So when I try to look at the map, you can see that 6 hours actually cover 5 out of the 10 most populous countries. That's including China, India, Indonesia, Pakistan, and Bangladesh. So it's actually just 1 point entries. It can really spread so fast. So actually, this is what my organization, Southeast Asia One Health University Network, trying to do. We try to develop solutions to help with pandemic prevention, preparedness, and response. So we hope that the next outbreak will be caught and contained earlier and would not be as bad as the COVID-19. So our organization has been established more than a decade now. So we are a group together established in late 2011. Start with a very small group. So starting with only 10 universities in 4 countries: Indonesia, Malaysia, Thailand, and Vietnam. So with the imagination of the rising threats of this, the effort has been grown, the network has been grown from 10 universities right now to over 102 universities from the 8 Southeast Asian countries. Adding on is Cambodia, Myanmar or Burma, the Philippines, and also Laos, PDR. We also have associate member countries from Taiwan that working together with us. So currently, we actually are talking to our South Asian universities, such as the one from Bangladesh and India, to forming such network. So our effort is to start to develop a resilient and competent One Health workforce to effectively prevent, detect, and respond to infectious disease threats by leveraging what university actually doing well, which are education, training, and research. Right? So the aim for us is try to promote the role of university in basically 3 areas, 3 major areas. So one is to build the capacity of professionals across sectors to solve complex One Health issues. So when we try to promote and educate the professional, it's not only for the technical skills alone. So what we call is about the soft skills. So we try to emphasize that the communication, collaboration, coordination, and all this C, critical thinking, cannot really be taught only in the classroom, in the lecture hall that you are sitting in like this. It's very difficult. It needs a new way of teaching. So we not only promote the technical skills alone, but how we're going to promote the soft skill more into the teaching. The second one, we try to promote that the university conduct the research that really matters for the policy decision makers. I was one of the faculty members myself long time ago. So when I was faculty member back then, when I did some research, I just do a research for publication. I did what I enjoy doing it, right? To publish for that. I didn't think too much of whether my result is going to be picked up, being read, and matters for the policymaker at large. So we try to stimulate those thinking. Whatever that being published should make into a short policy brief and make it into the decision maker process. Because I hear stories from time to time that when the policy decision maker would like to do craft some policy, they go to the gray literature, they go to academic literature, and they couldn't find too much evidence that what they want. So we try to bridge the gap between what policymakers really want and try to stimulate the researcher at the university to tackle on those challenges. Last, I think the university can be assistant arm to assist government in public health search capacities. During the COVID-19, we see that the health professionals are really overstretched, right? They have to work around the clock, they hardly get the time to sleep. So we believe that the university, through the faculty members, to the graduate students and others, can be a helping arm being deployed in the field to be assistants, such as can be assisted with outbreak investigation. And university also, like university lab, can be helping with the laboratory diagnostic for the COVID-19 to alleviate the burden from the reference lab at the national level. Also, university also being a catalyst for so many innovation that it required, including manufacturing of vaccine, equipment, robots, and so on and so forth. So this is in a nutshell that we're trying to do at the Southeast Asia One Health University Network. Thank you.
Thank you so much, Dr. Pat. And now we would like to move to Professor Richard.
Hello. Yeah, so I want to say thanks for letting me be here, and actually I want to say one special thanks to the youngsters in the room. It looks like there's a lot of students here. This is your future, and honestly, that's what we need. We need a future. That's partly what you're hearing. And I looked at the questions, and I don't have much to say. I'm not going to say much here. I'll save my comments later. But I'll tell you, 13 years ago, in the United States, we took a look at, I'm a specialist, but we looked at cancer care and who delivers cancer care. And we actually identified there weren't enough physicians, there weren't enough nurses, there weren't enough pharmacists that were going to be trained to take care of the people who are aging. This is in the United States, this is also across Western Europe, also in Japan. We have an older population and we don't have enough people to take care of us. And so, first of all, we need the next generation. And secondly, I also want to talk about COVID. I'll make the comment about COVID because, yeah, COVID was a disaster. There's no question. And we all have personal experiences when we took one-on-one treating COVID. I have friends who worked in hospitals that had to bring in refrigerated trucks to basically handle the dead because there weren't enough room in morgues to put the people. So it was in the back parking lot. They would just bring out and store a frozen body because there was so much so fast. But what did that, the problem would have been if we stayed and just accepted that, but also with regard to how do you deal with challenges, you take the challenge and you create change. Change is what you need. Change in the way we do healthcare in 2010 is not how we do healthcare in 2023. Things have been forced upon us, and we're taking that challenge. In the United States right now, we don't have enough physicians or nurses. Who's going to provide primary care? Who's going to provide the aging population? Well, now there's a whole new discipline, a whole new professional body. We call it physician associates and nurse practitioners. People who have had 4 years of college and then go for 2 more years, but they are our primary care. They work off of standards, and they are basically delivering care to the country. And where, like myself as a specialist, I can then focus on the more complex issues. Second, we don't have enough hospital beds to take care of sick people. Our population is aging, and you could put someone in the hospital, but once you have a hospital, you use the bed. And then you don't have room for the next person. So there's a whole bunch of innovation going on now, like hospital at home. Telemedicine is here. I see half of you in the room using your cell phones. You're talking to somebody, you're connecting with somebody. Well, we can deliver medicine that way. We are delivering medicine literally by cell phone, by tablets and computer screens. People aren't coming to the docs anymore. The docs are going to the patient's home. The technology is there, we can do it, and the world is moving that way. And one of the biggest issues is how do you get paid? Because at the end of the day, you have a job, and the traditional is it's face-to-face. Well, our government is changing that. They're saying we recognize that if healthcare can be delivered at a distance through a camera, well, I had to pay for that. Because it's okay as long as the job gets done right. And so I think that the future is changing. COVID was a disaster for all of us. 7 million, whatever I think you just said. It's a disaster. But we can grow from it, and that's the important thing always, is never be satisfied with the norm. You see something, fix it. And I want to give my great compliment to Dr. Krasentu, who in her plenary talk, she went ahead and created change. That was a phenomenal presentation where in Africa, you can't get health care. She's probably impacted the lives of thousands of people. That's kudos to her. I'll stop there.
Thank you so much. Now we move to, last but not least for the first round, Assistant Professor Dr. Tirani.
สวัสดีค่ะ Tirani ค่ะ I'm from WHO Thailand and ใช่ไหมคะอะไรนะคะ
No, you first.
Sorry. So first of all, our congratulations to Mae Fah Luang University for the 25th year anniversary, and also we would like to extend our thanks, our appreciation for your invitation to the UN agencies, and so they have identified us, WHO, as a specialized health agency to come and represent the to attend this panel. So I see that the audience is quite tired. It's Sunday afternoon, I understand. So I'd like to engage you a little bit and maybe ask a few questions and just see how you react and answer to this. Who have been to the hospital within a month, within 30 days, this past 30, who have been to the hospital, please raise your hand.
Anyone?
Anyone?
A few?
Okay,
10,
a
5,
few.
6?
Great. So would you say, did you have to pay to go to the hospital? Yes, you had to. You had to. Yes, you had to. Would you say it was a somewhat huge proportion as compared to your income? Yes. Okay, so my point today, I'd like to stress, I think the panel has touched upon this a little bit, is the form of health protection, okay? I think Thailand, being an upper middle income country, we have a very similar health profile with the other countries. We are having the burden of NCDs, we're having this vulnerability to emerging and re-emerging infectious diseases. So those are unfinished agenda. And then with the low fertility rate, okay, children are not being born, and we are shifting towards the super aging society. But what I would like to stress is actually our ability to ensure that people can go to the hospital, get the care that they need, appropriate care, safe, quality care, and the most important keyword is affordable healthcare. And I think in Thailand, we are very fortunate. Thailand has this remarkable achievements in UHC. We call it USC. It stands for Universal Health Coverage since the year 2002. All Thais, we're protected by some sort of scheme. There are 3 schemes in Thailand. And so being born Thai, I think we're very fortunate. And with the public health system and also the private health sector as well. I have talked to different embassies and representing here today. They said a lot of tourists actually are coming to Thailand for medical tourism. So healthcare in Thailand overall is great. But then my point today is also another population in Thailand, which are non-Thai. Okay, so there are a large number of, sorry, I'm just going to get to the statistics quickly. Okay, so Thailand, as we know, is an economical hub of the region. And we're home to 4.9 million documented and undocumented migrants. And it is estimated in 2018, only 3.3 million documented migrants, only 60% of them are insured, meaning they do not have health protection, okay? And so we know that the Thai government, as WHO as well, we're working with the Thai government to ensure health equity among this non-Thai population. And it is among a very important area in the country cooperation strategy, as you have introduced. It's a midterm strategic plan. It's a WHO midterm strategic plan with the Royal Thai government. And so we're working to improve the health literacy of migrant and non-Thai population, as well as to create health equity and also migrant health management system. And I think you have heard during COVID many times, no one is safe until everyone is safe. So I would like to reiterate the importance of the non-Thai group in Thailand as well. Thank you.
Thank you so much. And now, save for the last, our president.
Okay, it's my turn now. Okay. I think we here we faced and we have the same challenges that as the ambassador said that we have the challenge on environmental crisis, transboundary haze pollutions, and also we also face the same challenges in economic crisis like food insecurity, financial insecurities, and also career insecurity. So this is kind of the challenge that we are facing now. And then I would like to add more from health crisis that we already said about the COVID-19 pandemics. Another one challenge that we have in the regions is that about the inequality, both in commercializations of educations and also the assessment to health services. For the commercialized on the educations, as we now know that education is more like not for a good, it kind of the things for sale, thing for trades. How we change this one to be like educations for a good public good. And another one thing is that access to public health services. As Mae Fah Luang, we located on the borders and also in the GMS area. I think what Mae Fah Luang can do for help in this aspect is that we can, first of all, we can try to generate relevant knowledge, both in the health or about the public health and also in socials, because if you know only public health, you cannot solve the problem for people or for the public in the area. So you have to do the research on socials and the public health together. So this is one thing that a higher educations, as we are Mae Fah Luang University, we can do. The second one is we need to foster learning. Like we try to foster the learnings that we can address the crisis, the current crisis that we are facing, so that we can promote the lifelong learners and we can help or we can develop our students to be a learner, like lifelong learners. For Mae Fah Luang, another point that we can have the roles as we are the higher education still in GMS. As we established since 1998, we concerns about public health and we focus on the public health. 10 years later, we can do it. We focus on public health by focus on reduce the illness with 3 P. The first P is promotions. How we try to make individuals or communities to take care of their health so that they can reduce or prevent themselves from illness or from sick. So this is the one thing that Mae Fah Luang focus on. The second P is prevention. This one that you try to help people to prevent themselves from get sick, and so that they will reduce the cost to go to the hospital. So this one is the second P. And the third P is predictions. We have to use technologies, data to analyze and then monitors and forecast if the illness is going to happen or whatsoever. So this is what Mae Fah Luang can do as a higher education institute on GMS regions. Thank you.
Thank you so much. So let me wrap up a little bit from the major challenges and the role of TICA and important factors that move to the COVID-19, and also what Professor Richard mentioned about change, and also come back to you talking about undocumented migrant, and come back to Mae Fah Luang University that we are located in the Greater Mekong sub-regions, and we do not left anyone behind. So that's why we located in this point. So thank you very much for the first round. Please give a big applause for the first round. Now we come to the second round. Second round now, it is more like for the futures of the higher education institutions in the sustainable era. So there are several challenges, as we mentioned, for higher education institutions to adjust, to adapt, and advance to transform in sustainable era to advance health and well-being for the world, Southeast Asia, and GMS. So in this regard, what would be a pivotal role for higher education institutions in the future in the sustainable era to promote good health and well-being in GMS or Southeast Asia? And in this case, also based on your own perspective, your experience of your countries, your own network, how would you try to promote or give us some ideas about future roles of university in the future? Maybe, yes, okay, Your Excellency, you want to move?
Okay, thank you for the second round. Just let me add a bit about Laos and Thailand on the framework of cooperation, especially TAICA help us. I think we still have some scholarship for ACMAC frame. Yeah, 30 anniversary of Lao-Thai diplomatic relation establishment. And I think it's a good idea if I propose to have 2 scholarship for the medicine. Just, Madam President, I want TAICA to put out 2 scholarship to Mepha Luang.
So now
Yes.
we have a partnership already. Please
Still
give a
pending.
big applause first.
Because they keep 5 scholarship, 2 medicine, 2 engineering, and 1 for culture. But the 2 one, just after learning how we discussed today, I think the right place to put our 2 scholarship here in Mepha Luang. And I
This is what need to be done to actions. Already we have a partner.
yeah. And for the UN SDG goal touched by our TAICA guests, I think that we still one big challenging facing Laos. Is it the number 18 SDG, the unexploited landmine, UXO, we call it. UXO, actually, during the wartime, Laos have been bombed, I think, 3 tons something. 3 tons per our population at that time, 3 million. It means 1 ton per head, you know. Sorry, Richard, is it during the wartime? I don't mention who bombed our Laos, okay, you know. And we asked some expert to come to Laos to help us how to clear on the UXO. Some experts saying that maybe we need 1 century. My God, 1 century. Even we asked the factory who produced the bombies there come to Laos and to see how we can make the program. Even during Obama administration, we get 90 million for the UXO in 3 years. And during my time in DC, we asked Trump administration move from 30 to 45 million per year. Still, but quite big money. But I think that we cannot clear in the need time. Quite take a long time. And of course, we still face daily casualties. Even our armed force, police, military, and of course the ordinary people, when they struck, they crash there, they bomb, they die daily. Just I want to ask some of them. But for the second round, I think of course we have the challenge like this, and thank you, Madam President. I think you touched on already how our higher education to cope with these challenges. Of course, I think that innovation, research, internship, put our students there, they study not only in the classes. And then please come to Laos to see what kind of challenges we have there and make research, a report, and of course up to our academic. How we can make another, adjust our curriculum to match our need, just in the case of Laos. I think more or less, Mepha Luang can do the best in terms of innovation to adjust what we need in the future. I just shortly, I want to add something. Thank you.
Yes, thank you very much for the real partnership that might be possible soon, very soon. Three stakeholders are there. Okay, please, Your
Okay,
Excellency.
thank you very much, Your Excellency. You put me on the spot here. We will try our best to provide assistance on your request. On the second round, for Tiger, we see is that developing human capital is the key for the futures. So we are focusing on the topic of our expertise that can be categorized 6 themes, namely sufficiency economy philosophies, public health, climate change and environment issues, agricultures and food securities, biocircular green economy models, and other sustainable development goals related topics. So this is, if the university think about the sustainables, this is what we are interested to collab with the universities and international organizations. So, and I would like to say that this 6 theme will still relevant for the futures, for our 3 years plan on 2026 and 28. As a part of this 6 theme, Tiger also concerns with the global and emerging issues as important issues that will take into considerations in implementing projects and curriculum, as well as in order to advance excellent health and well-being. I would like to stress that we should pay attention on the following issues. One is environment and climate health. Second is digital health and technologies. Third is One Health approach. And then fourth is mental health and well-being. This is what we would like to focus. And we also see that the food and agriculture topic is very important to us. So for the sustainable development. So we look at the food security and resilient as the one topics. And second is urban agriculture and food system is the one that we would like to focus. And third is nutrition and education and food literacies. So in conclusion, I hope that what I have mentioned about Tiger, that we would like to focus, that can help inspire the Mae Fah Long universities and other educational institutions to adjust and adapt and advance its role to strategies in advancing health and well-being in this region. Thank you very much.
Thank you so much. Give a big applause to Your Excellency. Now we move to Dr. Vipat, please.
Thank you. For the second round, we heard a couple of things. Of course, we heard One Health approach, the last round, about the career insecurities and fostering lifelong learning. I'd like to touch a little bit on that. I take a regional perspective, not just for Thailand. So I work in the regions, seeing many countries, traveling all to the member countries. So let's start with a quote from the QS World University Rankings, which reported on the global graduate skill gaps and mismatch expectation, which is done in 2018, but I think it's relevant today. I think all universities aspire to be a high-ranking universities. So this is what it says. It is become more and more vital that university also prepare graduates for the world of work. This means that the development of soft skills like team playing and resilience often become as important as the technical skills and knowledge acquired during a degree. So let me pause here and just follow up on the first round. So if you imagine for the one who already take work, when you graduate the first time and you get hop on your first job, how did you feel there? So let me share one of the stories that I visit during the simulation outbreak exercise in Malaysia. So this gentleman graduate get a bachelor of veterinary medicine. So he get a DVM degree, a doctoral veterinary medicine from his Malaysia University of the University. He get his graduate degree from Australia. Going back and doing his business work at his family that's raised chicken farm. So he went there, graduated, imagine before he graduated how many years he studies. over two decades of studies. A couple years of kindergarten, 6 years primary, secondary, another 6 years for high schools, another 6 years for DBM, maybe another 2 years for masters. He went back and started and doing his own business work at his family. He totally admitted that he was not ready. He can be the best veterinarian, taking care of his chicken diseases and others, but he cannot control or learn how to communicate good work with his workers, which are mostly migrant. So he had to spend about a year on the farm, on that farm, trying to learn how to manage, how to better communicate with that. So I asked a question, what's going on with our higher education or our education system overall? If we study for over 2 decades, and when we hit and try to work and we're not too ready, there must be some changes that can happen, right? So how are we going to foster that? How are we going to foster more of the soft skill? How are we going to be better and hit the ground and running once you get your first job? So we cannot teach everything by sitting in this classroom like this. So our group of university trying to shift whatever that in the regions from the lecturer to be facilitator. Try to motivate the student to learn more. Shift the student from being passive, like everyone sitting here just listening, to be more active. Right? It didn't have a tool there. I don't want to fall out, but I already have a game exercise. But to learn more, so you remember all. So we also try to promote having a student from multiple disciplines learning together because we believe that a different perspective actually matters. So coming in, people may view in the same thing from different angle, but there's no right or wrong answers. And this is very, very critical in promoting and fostering collaboration in the future. So I'd like to stress that upon, not only for the higher education space. So we try to have the student learn. We try to promote having a student club together at the universities. So the student can take what they learn, going out in the community and teach the communities, including related to the health. It can be on rabies, it can be hand washing, hand hygiene, it can be how you wear the mask properly. And this can help promote the health for all, for not only inside the university but into the communities. We also try to challenge that we should think of the One Health approach or the promoting health beyond universities. Right? So if you think about what we learn here, we should start the conceptual, to break down the barriers of this basic concept, should start as young as possible. We talk a lot about prevention, we talk about behavioral change, but would it be better rather than try to change the behavior that we know that we are not very good at that? Everyone has a New Year resolution, most people. How many people actually accomplish what you said? You see that how hard or how difficult behavioral change is. How about fostering a good behavior? If you think of that, to be able to fostering a good behavior, we try to push that to school kids, right? The younger you are, the better it is to promote a good change. So that's why the Sihun actually trying to promote One Health education, which comprise of different things, including a One Health basic concept. It can be hand washing, hand hygiene. It can be rabies. It can be worms, malaria, so on and so forth. It depends on the school, and we're doing that with the Simeo Trapmed and StepMed, and already try to embed the basic knowledge of interconnectedness between human health, animal health, and environmental health. So that's why we try to push a One Health education for all, and hopefully to make our ASEAN healthier and better. Thank you.
So much. So we move to Professor Richard. The PowerPoint.
Yes. So, I was thinking about this topic, and I just thought I would take it in a little different direction because I am probably different in medicine than most doctors are, where they talk about primary care, they talk about tertiary care, but I'm quaternary care. So specialists refer to me. So I run a bone marrow transplant program. I treat leukemia, lymphoma, myeloma, blood-based diseases, but they're relatively rare diseases, but they have huge impact. And so what I wrote here, this is the topic, was, I said observations from an academic lifetime. These are the questions we just heard that we're trying to answer. Where is the higher education institute? What role does it have? And what factors do we see? So as a doctor, to try to deliver care, or a public health person, or a nurse, at the end of the day, no matter what, there's a lot of influences, but we have to put a patient at the center of all the attention. Is there access to health care? Is the right therapy there? Is there payment for there? Is the government going to cover it, not going to cover it? When we have a one-on-one interaction, the patient is the center of our attention, and that's what we try to keep that always in focus. So why am I here? Why was I invited? One, because I was, OHSU is a wonderful collaboration with this team here, but I've done 40 years now of being a bone marrow transplant doc. I have over 300 publications. I have published a textbook and now in a 3rd edition. But you know what? It's just paper. That's history. It doesn't matter what I did. What matters is what am I going to do next year and the year after and the year after that. I've founded a transplant program. We've now treated close to 5,000 people in Oregon where there was no transplant program before, so I have a legacy. And we do all sorts of transplants. And Oregon is maybe not what you think is the big center, but we cover such a big distance and area that there's 175 donor transplant programs in the United States. We are the 10th largest. And this is our volumes. This is a picture of our volumes. It's gone up over the years, and it's a steady increase in our ability to deliver care. What I was going to point out, though, it isn't me. It's a team. We work as a team, and that's what an academic institution teaches you, is that you can't do it yourself, but you could have an idea, but you need a team around you, you need people with you. And I've had the opportunity to train many, many people who are part of our transplant team, and they've gone on to other jobs, and they're other transplanters. And so we continue to spread our educational tree. We start small, we get bigger. How do we serve? So this is the west coast of the United States. And I'm leaving off to southern with Los Angeles. But in the world of transplant programs, that's a lot of country, and there's only 5 academic centers that deliver this. So we treat people over 100,000 square miles. You'll hear me say that again. But how do you have to do that? How do you deliver that? And can you give care? And so I've also done as I said just to one of my colleagues up here, I have a hobby, which is healthcare economics and access and value. And so I published a paper 8 years ago. What is the cost of transplant? And the cost of transplant at the time was about, for an adult, over a 5-year expanse was American dollars, $460,000. We just published another paper this year with new technology, all the new things that are coming 8 years later. It's now estimated at $1 million over a 5-year course for that individual. Now that's a lot of money. And I'll talk about the T-cell therapy in a minute. And you could sit back and say, is anybody worth $1 million? But what you have to do is ask the question, are you getting value for that money spent? And a lot of the issue is when I spend that money, and when Thailand gives that care, and they deliver that care to an individual, that's an incident of care. It's important to assess value over the lifetime, a burden of care over a lifetime. Thalassemia is one of my interests, and if you can intervene at someone age 1 or age 2 and cure their disease, you are going to save actually millions of dollars over the burden of disease over a lifetime. So cells are now drugs. Yes, you talk about you saw pills and you saw potions and you know about IV fluid. Well, the cell is the drug. And the big industry is moving into using the cell as a carrier or the cell itself as therapeutic. This is what I do. in the middle of this is the 5-year view of the market, of the business world of cells as drugs. If you think of a cancer, it can be treated. Right now, multiple sclerosis, lupus, a lot of diseases that your family members have are going to be able to be treated with drugs. Actually, arthritis. You're going to be able to put cells and rebuild your spine, and you're going to be able to help that, but it's going to cost money. So I say, though, you can't be frightened of technology. I love this picture. This is for those of you who don't know, and most of you weren't born at this time, but in July of 1978, that was 45 years ago, there was major fear across the world because it was going to be the first test tube baby, the first in vitro fertilization, Mary Louise Brown. And this was the cover of Time magazine, and the interview was, my God, the potential for misadventure is limitless. What if we have a perfectly formed individual who's a cyclops? Well, who's going to be responsible then? The doctor, the government? And the fact is, we yawn now. Everybody knows in vitro fertilization works, but you don't even think about it. But 40 years ago, it was scary. We can't be afraid of the future. Today's dream, I say, is tomorrow's reality. And so I mentioned change before. I believe in change. Change is Charles Darwin taught us that change is evolution over time, natural selection. It's gradual. Well, Stephen Jay Gould talked about punctuated equilibrium and saltatory evolution. You could have been having gradual evolution, but then the asteroid hit. The dinosaurs are gone 60 million years ago, and there was a sudden change. COVID was an example of punctuated equilibrium in causing a new evolution. Sometimes things make change happen faster. At OHSU, building a transplant program was gradual. Phil Knight, who owns Nike, you came up and said, I'm going to name the Knight Cancer Institute, and gave OHSU basically $500 million, which matched to be $1 billion to build our cancer center. So that's one individual who made a difference, but he did it because the grassroots was there and he thought the foundation was there at the academic center and allowed something to be built. So just a couple last comments. Paul Farmer was a medical student I met in Harvard back in 1988, 86. He actually was, as a college student, was going down to Haiti and helping build a mountain health clinic. Well, what happened is that was gradual. He was raising whatever money. He'd go to my friend from Laos and say, could I get $50? Because I could then, help out. But then the MacArthur Foundation recognized him as somebody doing something that was extraordinary, and he got a MacArthur Foundation, and he took the money, he didn't take it for himself, but he created Partners in Health. And these are quotes of him. He's created worldwide change in how we deliver care to, the underserved areas. And at the end of the day, he emphasizes, like on the right, it's all about partnerships. And what he emphasizes on the left, everyone matters. Derek Bach was the president of the university when I was there. There was an issue about how should we put restrictions on who comes in, really tough, criteria. And basically he said, you know what, as a university professor, do not hold me accountable for those I let in. You only hold me accountable for those I let out. The doctor here, she's going to make sure when you graduate, you are the best you can be. And to me, that's the best definition of education I've ever heard. And finally, even my own president, Joe Robertson, who's part of OHSU Global Health, basically said, OHSU is a campus, but my campus is in Portland, Oregon. My state, my region is my campus. So we don't have the patients come to us. We need to learn how to go to the patients. So why am I here? Why was I invited? Because OHSU is trying to establish collaborations with Thailand. There's at a global health, at primary care, and now we're building collaborations in bone marrow transplant. I would point out that I have a catchment area of 4 million people, and we do about 300 transplants a year. Thailand's got catchment area of 70 million people, and at the moment, they're doing about 300 transplants a year. I think there's room to grow, but it takes people, it takes, a lot of individuals to build the health system and build delivery of care. So I want to congratulate everybody. Although 25 years is fantastic. The next 50 is going to even be better for this team. I mean, OHSU has been happy to partner. We look forward to continuing the partner. Vision, commitment, stamina in patients is what it needs. And this is the last slide is this is from my office. So if anyone ever comes to Portland and wants to visit, I've got this wonderful view over the mountains. Thanks.
So much, Professor Richards. Now I would like to move to Dr. Tirani, please. We might have to squeeze a little bit.
So for me, I think I'm just going to echo the entire panel. I think education should now be very multidisciplinary. I was, just to share my personal experience, I was trained in infectious diseases, but now I ended up doing everything in the universe, under the healthcare system. And when we say global health, it's basically, everything. So education should be very multidisciplinary. And, as Dr. Vipat has mentioned, we have to adapt to the changing health profile. But I also would like to highlight the other skill sets as well, soft skills, not only the technical competency, in areas that we have this expertise, but other sets of skills such as problem solving, teamwork. As Prof has mentioned, he has a good team, to be able to achieve the transplant. Also, cultural sensitivity, awareness, and that's my personal reflection as, as a Thai working in international organization. We work with people, from across the world, so it's very essential that the graduates have this, cultural sensitivity and awareness. And those are for the students. So for university also have a role, to ensure that they have the pivotal role in this global health challenge. So before joining the WHO, I was also an assistant professor at Kyoto University in Japan for 5 years. I was lucky to be involved in the development of a so-called double degree program. And so with Thailand, actually, Mahidol University, Chulalongkorn University. And I found that when university pooled the resources, the classes, the one project, the students can work with 2 universities. I found that very useful, very beneficial in terms of resources, in terms of the students' experiences. It opens up, totally different new experience for the student. So the student can learn about issues in Southeast Asia, students from Japan, for example, and Thai students can also learn different issues in Japan. So I found that very, very useful, just to share my experience. Thank you.
Thank you very much, President.
Okay, so I do agree with you all. We are living in the changing world, so the learning changed, the learner changed, and the higher education institute must change as well. So what we have to do is that we need to transform ourselves first. How we do, as you all said, that we cannot work alone, we have to work together. And for higher education institute, we have to work with the private sectors, with the industry, or even with the community. So this can help a lot to transform from now to in the future works. And also, for the research, I think we should no longer do the monopoly research. We should do interdisciplinary research, so that can solve all the complex problems or complex crises that we face nowadays. For Mae Fah Luang University, we must join the collaborations with the country across the borders, especially Laos, Myanmar, and as the embassy said that the TIGA provides scholarship to Laos and then study at Mae Fah Luang University. That would be a good partnership. Thank you very much.
Yes, thank you very much for the second round. I think we drive everything through the last round, which is about partnerships. So it's going to be very short about the last round. And the last round would be, in this case, what kind of approach, models, or policy for international or local to have partnership with higher education institutions? How to transform the higher education institutions to work with other stakeholders or partners? How can public, private, and partnership join hands together as not just lead country, but transboundary? That's the questions. And again, I would like to go to Your Excellency.
Yes, sorry, because we run out of time. Just,
Very short, sir.
yeah, I think that for the policymaker, I think not exactly from the government. Just let even our students here, after they learn, they listen what our discussion today, they can think of what kind of policy we need. Of course, for the partnership, regional partnership, I think even Mae Fah Luang, from the history, I think 25 years, they have quite good cooperation with, even with Laos, our region, under scheme of GMS. MOU, you sign quite a lot, and maybe tomorrow I will touch a bit about Laos and Mae Fah Luang, what we done with it. And of course, I think we think of the academic, not only the politician, I think. Politician, something they lie, and then they're not sustainable. Yeah, think of our academic, our student. Just please, when you do PhD or master, just make sure that your research, the theme of your research, just respond to our demand. I think this is another good idea to recommend you on our student here. Thank you.
Very much. So we go to the second speakers, please. A bit might be so short.
Okay,
some short.
will be very short.
you.
Actually, can you put on a slide just quickly on the third round?
There is a PowerPoint.
Yes,
that- yeah.
PowerPoint. My humble advice is, can you move the slide? My humble advice to the university is maybe there's a modality that maybe we can emulate in a GMS and ACMEC, like IMTGT or Indonesia, Malaysia Growth Triangle is Uninet, which means that the university's network can act as a think tank for the policy makers and for the even private sectors. Now, so this is just a sample that there's a split into working group, transport, connectivities, and one is trade and investment, and then tourism, and then agricultures, and then halal food products, environment, and HDR, and also human resource development and digital economy. So something that maybe Uninet can be formed in ACMEC and GMS. And lastly, I would like to request Mae Fah Luang as our partner to help us, TICA, to promote our FFT, or Friend from Thailand. Is a volunteer program that oversees projects at our neighboring countries. So I would like to urge alumni from universities aged from 21 to 35 years old to participate in our FFT program. Thank you very much.
Thank you so much. So we move to Dr. Vipat.
talking about partnership, we have to build a relationship and trust. First, we have to get to know one another. The partnership, the potential partnership like this, like we mentioned here, won't be there without we meet one another. So by fostering such a large network that we have with over 100 universities, this is a instill into 3 points. We need some type of the steady leadership and the strong secretariat, the one who gonna coordinate to make things happen. Second, we need to have a structure, both governance and operating structure, that everyone agree upon, who's going to take lead, how we're going to rotate, how often we're going to meet, all those sort of things. The third thing that I see as a key and in how we build our network today is the sustainable investment or commitment. So without the fund, we will not be able to compete. So in sum, in terms of partnership, like to borrow the wording that our Indonesia One Health University Network often say is less me, more we. And then we're going to be better altogether. Thank you.
Thank you so much. So we move to Professor Richard.
So try and be quick. So I was going to be long, but I'll just be quick. So you could bring people together. And, I've done that. I showed you that the cells drug is a very expensive enterprise. But 13, 14 years ago, I organized the first meeting of CEOs of cell therapy companies with chief medical officers of insurance companies. The insurance had to know what was coming. And I can tell you, the people who were developing drugs and developing products were so focused at regulatory, getting to the FDA, they didn't understand the rules of the game, like how do I practice? So you do bring people together. And that's how partnerships happen. Academic centers are really well poised to do that and unite about single plans. You could have shared shared PhD programs between institutions. I know a colleague of mine, went between Stanford and Oxford and got a training program. You could think anything can happen. But I'm just going to finish with one other line that I learned another one-liner lesson is when you start, though, you got to set your platform. You got to say, here's the standard where we're coming from. Because how do you know 3 years from now that you did any good? So you have to have metrics. You have to be able to evaluate from where you were to where you are, and have I really gotten better, or did I maybe just waste time, effort, and we got to go in a different direction. So that's another important piece of education, is to teach you how to think and how to analyze. The scientific method is you got to break it down to its single parts. But then you synthesize, you got to put it back together and prove that what you put together is better than what you started.
Thank you so much.
So similarly, I agree with all the panelists here, but I would like to rephrase. We keep saying partnership, but I also want to highlight the term ownership instead. More, less of me, more of we, right? WHO, we are the secretariat to the member states. We support and we facilitate. We say that we're not the main fuel, we're the lubricant. So a lot of things we do on the ground, it's actually, we try to encourage ownership of the community, of the country, of the government itself. So I really like to stress the term ownership more than partnership. Thank you.
So much. Now we go to Madam President.
Yeah, for me, I think the key aspect for partnership, I think we should have the same goal or the same vision. So this will lead to long-term collaborations, and such it will be sustainable partnership. So that means if we have the sustainable partnership, we should trust, share goal, visions, and we should have a mutual respect to each other, so that we can contribute towards to the same goals. So this is what we have done with Oregon Health and Science University for so many years, and also with Tiger. So we have a good relation, a good partnership to each other. So it still continue. So this allow me, Fan Luang, to address here that we try to strengthening collaborations with all the countries and also the regions to contribute the realizations of public health and global regional and global health services and also agenda. Thank you.
Thank you so much. That's the end of the third round, and I think Madam President has concluded everything that how to transform what need to be done to actions. Now I would like to give the floor a bit, about 10 minutes, and I think we have one of the most prominent former Minister of Union of Tourism and Hotels, Minister Taeyong, would like to share with us.
All the wrong name or something. I'm sure. I'm joking. From where? Is Professor Romyan around? Yes. Ah.
My apologies.
Yeah, no problem. He gave me this talks. Always do like that. So, good afternoon to everybody. Sincerely, I don't have a plamion, and he is also my teacher. So I have to say something about the topic in very brief. After her request in a very short notice, I have scrambled my brain to get some facts regarding the topic of the symposium. Accidentally and fortunately, I found the file is The Good Doctors, which is just like a UN woman or something like Dr. Krishna, who is pharmaceutical scientist, formulated the first generic HIV drug cocktail. As she has already explained to us about the topic, I don't want to beat around the bush on her concerted efforts in the development of this dangerous disease. She is very dedicated, very decisive, hardworking, inspirational, and also helpful to the people around the world, mostly in the developed nations like Myanmar. So what I can share all of you upon her works is, number one thing is the important factors, meaning motivation by the sense of fairness. This is in her mind. He always keep in her mind like that. And then also she has sincere view, which is to get access to these essential medicines for the people. And the third point is she is very dedicated to bringing about local medicines to improve the health of our people in the region. And another one is the biggest obstacle. This is not a lonely project. She did it. She has to do with many people. And the journey is also filled with adventures, formidable challenges, achievements, disappointments, rewards, sadness, and also joy, both in Thai and in the region. She has to empower the local people, not only transfer to them the medical know-how, but also to show and make them believe they can produce medicines to improve the health of the local community. And she is also very ambitious. She was grown up from Samoa Island. And her family, her father was a doctor, her mother was a nun and something like that, or nurse, and her relatives, some are what we call, some are nuns, like that. The point is, she was taught by her grandmother regarding the spirit of perseverance against odds and to never give up. These are the very essential words for us today, especially the younger generations from the university should be learned. And another point is my personal points of view. This topic is very essential for us. Today we are talking about the pandemic, which is very serious and which is very difficult to get to the recovery stage. But now it is lesser, but according to the doctor from the WHO, it is not finished yet. It's still with many names, many variations are coming up from time to time. So what we need is, when we do something as a whole, the 3C, not like my president, is different from her words. What I want to tell you is cooperation, coordination, and communication, which are very essentials for the development of these medicines to produce by local people. The thing is, the strength is in our community, in the hand of our people. If you are dependent on or reliable on other people, you are able to get the goal in a right way. Sometimes it will be deviant. As we talk about public health, this is also very broad and very complex, very complicated. So when you are looking to the basic, is the fundamental is 3P. This is another 3P, meaning public, private, and people. Whatever, I'm coming from tourism. I was in the tourism industry for over 35 years, from the younger manager to the union ministers. So what I am understanding is public, private, and people. Whatever the public people do mistakes, whatever the private entrepreneurs do mistakes, one day the community, the people will suffer. There are many examples around the world. There are many destinations around the world. In a few years' time, it will be collapsed. That's another lesson that we learn from tourism. So the unprecedented issues are coming up, including the COVID-19. We should keep in mind is we are in the families, we are in the same boat. We should be empathy to each other. We should be united. We should be working hard to make resilience what sort of challenges coming up. So what I want to highlight you is not to give up, but never surrender to what obstacles are attacking us. The last but not least is a friend in need is good indeed. My brothers and sisters and all the younger generations, good luck for your future. Thank you.
Thank you very much for wonderful speech as a closing speech of these plenary sessions. And now I would like to say thank you again, sincere appreciations from Falun University, and we hope that this partnership will transform to ownership for all of us. Thank you so much.
Thank you, our speakers, for the inspiring and determined discussion. And now it's another photo session. So I would like to ask our speakers to remain on stage. We're gonna have our staff to set up the stage again. So please stand up. We're gonna remove the chairs.ขอเวลาจัดเวทีสักครู่นะคะ We're gonna have 2 shots. So the first one will be on stage all together, and the second one, I would like to ask the speaker to come on the ground and take pictures with the participants. ขอสเต็ปข้างหน้าหน่อยค่ะ Could you please step forward next to the rim of the stage? เดี๋ยวลงมาถ่ายข้างหน้าอีก Okay, and another shot, could you please walk on the ground and face the stage and turn your back to the audience. And also, please, I would like to welcome all excellencies to take pictures with the plenarist. So please, excellencies, could you please Okay, so the photographers will be on stage and we will do like a concert style that you turn your back to the audience. Miss President, could you please move toward your left? So you'll be in the middle. Thank you so much. Our participants, please stand up in the back. Please stand up so we can see you all. Thank you so much for your cooperation.ไม่เป็นไรค่ะเดี๋ยวคิมจะเล่นหมดไหมคะพี่คะ Okay, so I will count 1, 2, 3, smile. This will be our memorable moment. Keep smiling. I can't count now too many cameras. Okay, thank you so much. It's very meaningful today for our symposium. Your presence here with us really meaningful to us. We really appreciate your participation here. And now we are reached at the end of the symposium. I would like to thank you very much for your participation. I hope you enjoy the program, and for tomorrow, there will be ceremony to pay homage to the royal statue of Her Royal Highness Sinakarintara at 8 a.m. at the Princess Sinakarintara courtyard. And significantly, our 25th anniversary celebration ceremony will begin at 9 a.m. in the morning at the Princess Sinakarintara Auditorium or C4. Wish you have a pleasant day and see you tomorrow. Thank you. Bye bye.